Peggy. Thank you for joining us today, and I hope you can stay with us. We will have a phone number and a website, and I have an expert here with me. And we're going to talk about good health, the common sense things that you and I can do for ourselves and our families to build health, to healthy lifestyles. And I have somebody here who deals with helping to restore people. And so I'm delighted to have Stephanie Hoops here. She is an oncology nurse,
Yes.
and with the Greenville Hospital System, the Greenville Hospital System Cancer Institute.
Yes, ma'am.
So that's part of the big picture.
Yes, I work for a specific department called the Center for Integrative Oncology and Survivorship.
And she is also the president of the South Carolina Upstate chapter of the Oncology Nursing Society.
Yes.
Wow.
So it's a great society that promotes oncology nurses across the nation. There's a national chapter, and then also our local chapter, which extends from Spartanburg all the way down to Oconee and Anderson.
Okay. Well, you look very official.
Thank you.
And you're originally from Connecticut?
I am. I'm from Western Connecticut.
And you're also an artist and a designer of clothes?
I've spent a little time in art school, yes.
That's great, Stephanie. Well, we appreciate your giving us some of your time. And you work with people who have cancer and are in the process of healing, and you want to get them back to recovery and living a good life.
Yes, specifically I'm a survivorship nurse navigator, so when somebody is done with all of their treatment, they come see myself and another navigator over at CIOS, as we call it, and they get a treatment summary which wraps up what happened on their cancer journey from their pathology and their diagnosis and all their treatments together. And then we focus on how to move forward and good nutrition and exercise, because nutrition and exercise and keeping a healthy weight has been proven to help prevent cancer recurrences and also secondary cancers.
So now, am I hearing you that weight plays into that? Somebody who is very overweight has a higher risk of cancer than someone else?
It could be one of those risk factors. So keeping what they call a BMI, which is the body mass index, keeping that at a normal level, which is somewhere between 19 and 25, can help reduce cancer risks and reduce cancer recurrences.
And of course we struggle.
Absolutely.
In the United States and certainly in the South with overweight people.
And nutrition, and I think nutrition has a lot to do with that. We do talk about plant-based diets.
Okay, now back up. Plant-based diets. You don't eat steak.
Oh no, I'll eat a steak,
do?
but in moderation.
Right.
We want, if you look at your plate, we want half your plates to be fruits and vegetables, and we want them to be colorful. We don't want just greens, we want greens and oranges and purples, because the colors are, the phytochemicals that make those colors are the ones that are going to help prevent the cancers and keep you healthy.
And this kind of information is good for all of us.
Absolutely. Absolutely. It's good for anybody, whether you have a cancer diagnosis or not. So they recommend that meat sort of as a side dish or used more for flavoring, and really concentrating on the fruits and vegetables and the whole grains.
But you do not recommend that somebody just totally be a vegetarian. I mean, if they want to, they can, but
yes.
That's not what you require.
That's not what I require, no, not at all. I think vegetarian diets are good as long as you're getting the specific proteins. You know, there are ways to get proteins in your diet as well. I'm not a nutritionist, but we do have a nutritionist on board.
So you help people with diet, with exercise. How much does your attitude and all that play into it?
I think a lot of people want to make sure they have a good positive attitude. We do want to make sure that you're focused on yourself and you're focused on helping yourself. So there's a lot of different ways you can do that, and that's why a lot of people look into integrative therapies in order to help either with their symptoms or help maintain a holistic view of their body. Taking care of their mind, their body, and their spirit, as they say, for integrative therapies.
So it's like 3 in 1. It's the whole package.
Absolutely. There's a lot of different type of integrative therapies that people want to do because they want to help them. Like, for instance, just simply, some people will take ginger for nausea for their chemotherapy,
Yeah.
include as well as the nausea medicines that their doctor gave them. That's integrative. That's the complementary part of integrative therapies.
Now, you're talking about Chinese medicine? You're talking about something that most of us find foreign?
Well, a little bit. There's complementary and alternative therapies will always encompass things that can help Western medicine, which is our traditional medicine system here. You mentioned traditional Chinese medicine. That's a whole medicine system.
All right, now what?
That's
And you don't just poo-poo that. I mean, there's value there.
there is definitely value. In fact, there's research being done, and we are doing a research study with acupuncture, which is part of traditional Chinese medicine, to see if that helps with hot flashes with breast cancer patients taking what's called aromatase inhibitors. So there is research being done to help back up these therapies.
And for instance, well, you mentioned the Chinese medicine.
And
part of it.
acupuncture.
And acupuncture. And that would be, is that a way to reduce stress and pain, and even if somebody isn't a cancer patient?
There's numerous acupuncturists out there that have been specifically trained, and the research has shown that some of these therapies, like acupuncture, will help with pain, anxiety, stress, quitting smoking.
Oh boy, now you just, boy, you rang a bell with me. So if somebody out there is trying to quit smoking,
it could be an option
that
for
would be
them.
an option they could look into?
Absolutely.
And you don't have to be recommended by a physician, do you?
Most of the time, the acupuncturists are their own therapists, so they have usually freestanding offices. You do not have to be recommended by your primary care physician. Although it's a good idea to make sure your primary care physician or whoever's in your medical team knows what type of integrative therapies you want to use.
So how would you go about, the world is full of people who do acupuncture. How do you know, what do you look for so that you have the right person? I mean, what?
You want to make sure, number one, that they've had the training. Most of them have gone through specific colleges in order to learn the acupuncture. You can ask for referrals from people that have gone to them and make sure, or even ask that practitioner themselves about their patients. A lot of them will have specific people that have recommended them. You want to make sure they're knowledgeable about that and they're not offering to cure you. If any practitioner says, oh, I'm going to cure you of your cancer, that's probably a red flag.
That's the time to back out
Most integrative therapies, like acupuncturists, they're not focused more on a cure, they're focused on helping you with your symptoms.
So well, that's a good thing.
Absolutely.
So it all works together.
And that's the complementary part of complementary therapies, where you're going to see your primary care doctor, you're going to see your medical oncologist, and you're going to see an integrative practitioner to help. So they both work together.
All right, so you talk about integrative medicine. What else is it besides?
It encompasses so much.
Acupuncture.
Again, you can have mind-body therapies. Mind-body therapies are things like guided imagery. When you go and somebody talks to you and leads you on this wonderful guided journey, close your eyes, relax, breathe deep, and that helps to get your mind relaxed and your body relaxed so you can be receptive to other things.
So relaxation.
Relaxation, exactly. Guided imagery, meditation, and mindfulness. That's part of that mind-body connection. Mindfulness is a wonderful way of being in the present. It's a way of, it's sort of hard to explain very quickly, but it's bringing yourself back into the present, being aware of what's around you, all your five senses, and then also...
and just being quiet.
Yes.
Which is extremely difficult in the world we live in.
Learning a way of dealing with it instead of reacting to situations around you.
Of course, some people have that time set aside for prayer in which they
Absolutely,
get
and
quiet.
spirituality and prayer is part of the mind-body
So
connection
it's
there.
all it's all one big package for healing, not just one thing.
Yes, it's not just take this medicine and this is going to help. It's take this medicine and also take this time for stress reduction and maybe getting a massage. Massage is part of the not biologically based, but the body and the manipulation type therapies, where you massage and that helps for pain and also stress and anxiety, obviously. If you lie down for a massage, you're feeling pretty good, but it also helps. It's also very healing for muscles and things. Yoga is a fantastic manipulation-based therapy. It works cardiovascularly, it helps your heart, it helps strengthen your muscles, and people find it's focusing on your breath as you're doing all those exercises or all those stretching and poses, so it's also meditative. You really focus on your breath, and it helps to get all that other stuff out of your mind while you're doing that. They find yoga very, very healing. Other type of movement therapies are also part of that manipulation-based therapies.
So you recommend this kind of thing not only to your patients but to anyone out
Yes.
there. If somebody's really, really stressed in their job or whatever situation, they may not be cancer patients, but they could benefit, for instance, for signing up for a
yoga class. Or a meditation class. Getting a massage on a regular basis is very therapeutic as well. You know, and integrative therapies also encompasses biologically based therapies like herbs and supplements.
Okay, now that's the other thing. That's a whole different
It is.
aspect. And it used to be that the medical world sort of, pushed that aside and didn't. And now it's becoming recognized more and more, isn't it?
Absolutely. Like I said, nutrition, we focus on good nutrition. For supplements, we rather not have people take a whole bunch of supplements. If you have a good diet, you are probably getting most of the supplements that you need. At the Center for Integrative Oncology and Survivorship, we do recommend vitamin D at a higher level. It has been shown that higher levels has a good impact on patients that have had cancer in preventing it from coming back. But for the most part, with your supplements, a lot of doctors recommend getting it from your diet, such as calcium. People at one time said, oh, take a calcium supplement, make sure you have enough calcium in your system. It's sort of changed. It now shows that we want you to get your calcium from your diet. We want you to try to get
There are plenty of ways to get it, like yogurt and
yogurt, skim milk, green leafy vegetables are some of the top 3 ways of getting calcium from your diet. You talk about herbs, and you really want to go to a practitioner or somebody who's really studied that and is very knowledgeable, because a lot of herbs have different interactions.
So you need to investigate and not just go and buy a lot of stuff off the
Yes,
shelf.
well, and a lot of those stuffs you can buy off the shelves, and you'll have one that has a combination of this and another one that has a combination and might have the same things in it. So you're taking
maybe
double
too much.
of, yes,
Yeah.
the double of it.
Okay.
So, and it's not, just because it's herbal and it's natural does not mean it's always safe. So you definitely want to be talking to your doctor and somebody who's very knowledgeable about herbs in order to go forward with that. And your primary care physician or your medical oncologist needs to know what you are taking.
All right, we're going to go to a quick break and we'll be right back, so stay with us.